Welcome everyone to Quests by Community. I'm Ricki Spencer, and today we're going to delve into a really important topic that's very close to my heart, as it's something that I do quite a lot, and that's being involved in the consumer health advocacy space and providing a lived experience lens into how we can make healthcare more accessible and equitable for all Australians. So today we're very fortunate to have Dr. Elizabeth Deveny, who is an experienced and well-respected director and executive with a strong commitment to providing sustainable health outcomes for all Australians. She also has a demonstrated ability to build and maintain positive, productive partnerships with key stakeholders and the broader community. Dr. Elizabeth Deveny is currently the CEO of Consumers Health Forum of Australia, the national independent peak body for health consumers. Her recent roles include the CEO of Southeastern Metropolitan PHN, CEO of Bayside Medical Local, and Chair of Southern Metropolitan Partnerships. She holds a Master's in Vocational Health Education and a PhD in Medicine Clinical Decision Support Development, both from the University of Melbourne. Welcome, Dr. Elizabeth Deveny, to our show today.
Oh, thank you so much for inviting me, Ricki. I'm really looking forward to this conversation.
Wonderful. So let's begin a bit of a background and to get to know you. Um, what inspired you to pursue a career in health advocacy, and how has that journey shaped your approach as CEO of Consumer Health Forum?
So, I think I fell into consumer advocacy rather than planning to do it. And that's because I've had a really long interest in health, but I'm not clinically trained. So, I've always been thinking about how something might impact me or my family and friends from the perspective of the patient, the carer, the person receiving care, the person in the system. And I think over time, I continued along that path and worked in a lot of different health environments, but always at the non clinical side of that, whatever that was in research or teaching. And along the way, more and more, I think, strongly advocating for change. So I feel like I just fell into it, if you like, rather than was called to it, but I'm very happy I'm here.
Hmm. And let's sort of now look a bit about consumer engagement, what that means for people who are listening. How does the Consumer Health Forum gather insights and feedback from consumers to inform different health policies?
So CHF started in the 80s, and it really started as a consequence of the HIV/AIDS epidemic at the time. The gay community was doing this amazing job of advocating for different ways of governments listening to community needs, different kinds of clinical trials and models of care being put up. And the work is remarkable and globally well known. So what happened when this was occurring is a lot of other people started to think about, gee, I think some changes need to be made in my healthcare, in the way that I receive care, and we could get together and do that too, couldn't we? So a lot of consumer advocacy groups started in the late 80s,
Mm.
and we're one of those. So we were first funded by Neil Blewett, and he said you really can't have a well-functioning health system if you don't have a strong consumer voice. And ever since then, we've really maintained that grassroots activism. So we reach out to thousands of Australians and ask them what they think should happen in health, and then we try and find ways of bringing that together in themes or reports or submissions to the Senate or surveys or social media tiles or articles in newsletters or things on our website. So many different ways to share their thoughts. And I'm fond of saying that it really doesn't matter what I think and even what my board thinks. It's important that we know what the community wants. And our job really is to be a vehicle for ensuring that those consumer needs, the community needs, are heard by government, by key stakeholders, and indeed by everyone.
Mm. One of the questions that I always get asked is, Ricki, how do I become what does a consumer engagement person look like? Do you have to be of a certain age? Do you have to have certain degrees? Can you maybe explain that a little bit to our audience? Like, what sort of consumers are you looking for when we're engaging in different aspects?
Well, we want everyone, is the short answer, and you don't have to have anything apart from a desire to put your views forward. So, some of the state based consumer health organisations offer training. So, if you're in New South Wales or you're in Queensland, for example, you'd be able to contact those peak bodies and say, I'm interested in being able to do this well. And they would be offering you some training in the key things, how to get your message across, the way the system works, and so on. But many people enter without that. Often people enter because either themselves or someone they love has a health problem. They have an experience with the health system and they end up being not very happy. So then they start to advocate, which might be a letter to the local newspaper or to their local hospital. It may be, speaking to their local MP when MP has a barbecue in their upcoming kind of election campaign. Um, People can join us simply by doing things like following us on social media or and our newsletter. And then we provide opportunities. We run webinars that will give you information. We do sometimes other kinds of training, and we'll often point out all of the other opportunities that are available, many of them free of charge. So if you're interested, just start by reaching out to your local, your state-based consumer organisation or to CHF or even to a peak body near you that's interested in the issues that you're interested in.
What are some of the biggest challenges facing consumers in the healthcare system today? And how is that sort of supported through the Consumer Health Forum?
Mm. So, there's a really long list, but I think when we talk to people, the one that comes up the most is affordability. Right now, there are lots of Australians who cannot afford to get essential health care. I'm not talking about optional extras here. I'm talking about basic things like being able to afford their medicine, being able to afford to see their psychologist, being able to go to see their GP. So when we talk to Australians and Australians talk to us about what matters to them, the thing that comes up the most is I can't afford my healthcare. Related to that is that I can't access it. So you have to have the money, but even if you have the money, sometimes people can't access the care. This might be because the care is not safe for them, it's not culturally appropriate, it's not inclusive, so they don't go to that care. It could be because it's not accessible, there are no ramps, there's no easy place to go. Perhaps the travel is a problem and the care is not provided digitally, so they can't get there, which can be because it's thousands of miles to go where they've got to go, but it can be 10 kilometres, but if you can't get there, you just can't get there. So access is the biggest second thing people talk about. And the third is always about equitable care. So care that is inclusive, that is not stigmatizing or in any way bullying or harassing. People sometimes struggle to find the care that will be right for them.
Can you discuss any recent policy changes that the forum has successfully advocated for on behalf of Australian consumers?
We have been pushing strongly for reduction in the cost of medicines for about 10 years, actually. And in the last year or so, the government has put a number of policies through the budget that have done exactly that. So some of your viewers might remember at the budget the co-payment costs for your medicines. The cost has been frozen. So they're not going down, but they won't be going up in some cases for a year or two, depending on whether you hold a healthcare card or not. We see that as a really good thing. We'd like the co-payment costs for your medicine so that that $7.60 or the $30 odd that you pay to be less. But we're really pleased to see at least it won't be going up. We also had been strongly advocating for people to be able to have access to their medicines without having to go to the GP so often. So we were involved in the work last year for the 60-day dispensing, which means now for some people they can get 2 months worth of medicine when they go instead of 1 month's worth. It's not for every medicine, but that does mean, again, not only reducing the costs because you're only paying in many cases for the one and getting two boxes, but also the travel and all those other costs I just talk about, the costs of getting to care. So they get reduced or halved as well. We put into a lot of Senate committee hearings as well, and often we see our recommendations are in the recommendations of the Parliament. And I can tell you that's very exciting for us to see that your ideas are actually being listened to and recorded as recommendations of the Parliament in terms of saying to government, this is what we need to do.
How does the Consumer Health Forum work to ensure equitable access to healthcare services for all Australians?
I think the most important thing for us, and we work hard on this, but there's still more work for us to do, is to get diverse views. So at the start of our conversation, Ricki, you were saying, how do people get involved? I'd love everyone who watches this to go and follow our socials, do an EOI, and come and be a consumer representative somewhere. Get our newsletter, print it out, and share it in their local community house. Because the more different views we get, the stronger our message is. So that's really important to us because that's how we understand where the issues are, where things are not equitable. We've got a sense of that because we are very engaged with community, but sometimes people will point something new out to us. And often, for example, talking to an amazing consumer leader like yourself, we'll have a conversation, you'll say something, and I'll go, oh, I hadn't thought of that. Better add that onto the list, right? So the more people we talk to, the more we have those aha moments with community, we add things on, and that might mean then we add an extra paragraph into a submission to talk about that issue. Or we put a question in our survey to address that issue and ask, is it just one person that's got this problem? Or is this affecting 50% of Australians? So we try to get as much diversity into our conversations as we can, but more is better. So everyone come on board and help us.
One question I get asked quite a lot when people, well, knowing that you were coming on, was they're asking, what about for those people, similar, I guess, to myself, who have a number of disabilities? Can they still participate? And how does CHF, Consumer Health Forum, support people with diverse accessibility needs to be part of consumer voice?
So I think we do a better job of that now, mainly because of COVID, as much as anything else, because a lot more of what we do now is virtual. I'd like to say we did that for accessibility, but honestly, we all had to do it. But the consequence of that has been that we're actually getting a more diverse view. So people like Maureen from Tambo in far west Queensland can now join into a conversation, whereas before, even if we'd held something in Brisbane, chances are she wouldn't have been able to come. So making a lot of our work virtual has really helped allow people to join in who might not have always joined in. We've always advocated that consumers should be paid for their time, and if they have to travel, pay for their travel. And right now, we're able to do that a bit more than we were in the past. So when we ask people to do things, we can pay them. Sometimes that means they can then travel or they can get the accessibility support that they need, which is really important. There are other things, though, that are still works in progress for us. So we do webinars. We've been using the closed captions, but sometimes we find the translations are not really great. And then we don't have the capacity to sit down and translate everything very carefully and appropriately. So we know that's something we need to do better. There are other things we know we need to do better. We might sound mighty, but we're a very small team on a very small budget. So it's sometimes hard to do everything we'd like to do. But again, tell us if we're doing something and it's not accessible or it's not safe for one reason or another, let us know. And then we'll work with you and say, well, how can we do this better?
Well, I can attest to it, I guess, because I have done quite a few projects with the Consumer Health Forum. One of the things that I was really impressed with was your actual expression of interest form, because it allows you to put in any accessibility needs. And, that's so important. And you also have an open box that we could also add if there's anything. So if you're neurodiverse or you're somebody like me who's trans, and also have a bit of dyslexia, that I can put that in so I feel safe, and that I know that if I'm going to put them in, that when I'm considered, that those needs are going to be supported. So I guess this now leads on to our next really important question, which is the future vision. So what is your vision for the future of consumer health advocacy in Australia? And what key initiatives are you now working for the next 12 months?
So we do want to see that every Australian can get access to the care that they need, regardless of who they are or where they live. We talk about postcode health, and we talk about people from particular communities experiencing more health disadvantage than others. So, in the long run, our vision is that that doesn't occur, and that in fact consumers are leading the development, change, improvement, or whatever you want to call it, of the healthcare system. So, we're actually listening to the community and asking them what they want, and that we have the capacity then to get that message out. What we can see a little bit of the gap is enough information going to consumers. So not only that they understand how to be a health consumer advocate, which is fantastic, but also really basic stuff like they understand how the health system works. There are some issues where there is a solution currently. So, for example, people can get subsidised allied healthcare if they have a plan in place with their GP. Sometimes they can get subsidised access to psychology. There are safety nets both for your medicines and for Medicare, but there are a lot of Australians that don't know this. So, we could make the healthcare system more equitable if we ensured that every Australian knew what they could get access to. What we see now is it tends to be the people that are already well advantaged because they might read and write well in English and they live in a city and their health literacy is high, perhaps they even work in healthcare. They use more of government health services than the people that perhaps don't meet some or all of those criteria. That's inequitable. So if you like, the government's providing something, here you go, this will help you. But the people who need it most don't always know it exists. We'd really like to see the government, and we've called in our last couple of budget submissions, fund us and other organisations to make sure that everyone does know how the system works. Everyone knows how to get the services that are available, in some cases freely or at low cost, and people know what to do if they can't find services or if the services don't meet their needs. To my mind, that would be, you'd like to think that in the next few years we could at least do that. That would be a really good start while we continue to encourage and support consumers to have a say. And the more that our organisation has the capacity to support people to do that through mentoring and training and the like, the better. And then over time, we'd like to see, particularly in governance roles, so that the people making decisions. So again, just so delightful to see you in so many key leadership places, Ricki. But we'd like you cloned, or else we want another 50 people just like you who are in all those really important rooms bringing up the issues that matter to you and indeed to many Australians. So that's our longer term vision, I suppose. The short term, especially given the cost of living issues, is really just making sure that everyone knows where to get care. And then it is, helping to make sure they know how to get it for free or for cheap, and how to have a say. And over time, making sure that they're having a say not only locally with their own care, but nationally or even internationally.
One of my passion areas, which is digital health. And I know that Consumer Health Forum has been right there from the beginning, being part of the evolving landscape. What with the rise of telehealth and digital health tools, how has the forum helping consumers navigate these new ways of working? And where do you see digital health progressing in Australia?
We've been fortunate enough to have some funding from the Australian Digital Health Agency, Ricki, which has allowed us to provide information in a variety of ways to health consumers about particularly the things that the Digital Health Agency is responsible for. So that's things like the My Health record that we all have, and electronic prescribing, and some other things as well. So helping people understand those new things that the government's paying for through putting in the infrastructure and the like, and making sure people know that's there, how to use it and how not to use it. Um, we've also done some, surveys and other research with consumers about a whole lot of issues about privacy, security, confidentiality, and so on. And we use those surveys and those consumer voices to inform government about what people's expectations are with these changes that digital health's bringing. I think the other thing that we have talked a lot about is this notion of a digital divide, this idea that there could be a gap between the people who are able to use these new digital methods and those people who can't. And I think our concern is sometimes people who can't access digital services are also the same people who have other issues with the health system. So, for example, to use a digital service, maybe you need to be in the city where you've got good Wi Fi. So, if you're in the bush and your access to care is poor, and then your Wi Fi is also poor, and now the service is going to be through a digital mechanism, it's doubly difficult for you to get care. Again, if the service relies on you being able to read and write in English, and that's not something you do very well, and now the service is digital, and so it's just all this text on a screen, makes it even more difficult, especially if it's not translated for you. Then it's even harder for you to get your care. So I think we're really concerned about the equity issue that the introduction of digital care might bring. And while we see it being great for a lot of people for different reasons, when they don't want to leave their home, they can't leave their home, to get care in their home is great. But we've also heard from people, again, just thinking of some elders we were talking to in the bush, who said, I don't want my GP to be an iPad. So I've got to balance it. And really, for us, again, it's hearing from consumers who say, I'd like my services like this. I like these things to be digital. Maybe you want your prescription to be digital and delivered by a drone to your front door.
Mm.
But then when you want to talk to someone about your sexual health, you might want to be in a room with someone you know well, with privacy, to have a heart to heart conversation. Australians do want to be able to access digital services, but they also want to be able to choose the mode. When do they want a hologram? When do they want an email? When do they want a face to face? When do they want a home visit? And I think we continue to advocate that digital health is great, but that we need to make sure that it's what people want.
That leads beautifully on to our next point, which is collaborations. Can you speak of any? You've just mentioned one partnership with the Digital Health Agency. Are there any other partnerships or collaboration that the Consumer Health Forum has formed to enhance the work of health equity and health policies across Australia?
Yes, there are. I've been talking already, if you like, about our collaboration with many thousands of individual Australians. That's our most important collaboration, talking to individuals and communities. But we do have some others that we would regard, as very important to our work. The relationship we have with the state consumer health bodies is super important. We tend to be funded for things that the federal government pays for, like Medicare and medicines. So the advocacy in that space. Our colleagues working in state governments often are doing more work in, say, the hospital environment, because that's what the states fund primarily. So working with them, we can join up our advocacy in the same way that the patient's journey needs to be joined up. So you're visiting your GP, then you might be going to a hospital, maybe seeing a specialist. You don't want the advocacy to be in bits and pieces. You want us to understand the issues all the way across. So those relationships with our state peak bodies are really important, as are the relationships with the rest of our member organisations. We're a membership-based organisation, so places like Health Equity Matters, AFAO, as people might remember it
Mhm.
as, NAPWA, like all our members. So hearing from them about what it is they need, what their members need, and making sure we build that into our messages and advocacy is very important. We also have relationships that are generally cordial with the professional groups. So you think of things like the medical colleges, or the AMA, or the Pharmaceutical Society of Australia, Allied Health, the nursing peak bodies. So often we find ourselves aligned, that we're all trying to do the right thing. We want to hear from the community, and then we can raise our voices together and say, this is a really good thing, government, you should do it. We don't always agree, and as I'm fond of saying to them, friends don't always agree. That's okay. And sometimes you might say that you don't want this, and we might say that consumers do want it. But ultimately, we work together pretty well in all of us trying to make the healthcare system better for everyone, particularly those people who aren't well, and particularly those people for whom the system doesn't work well.
Mm. And now we're going to talk about feedback mechanisms, because having a voice is important, but also how we can bring back change and closing the loop. So, what mechanisms are in place for consumers to voice their concerns? And how does this feedback come back and work with at the Consumer Health Forum?
When people have a particular experience in the healthcare system and things don't go well, There are lots of complaints mechanisms that they can use. So it might be they need to have a talk to whoever monitors and registers a particular health professional group. It may be they need to talk to their local hospital and say, I had a problem in the hospital or with my general practice. So there are lots of different ways that people can express any concerns they have. What we do hear from people is that there are so many ways that it's difficult to know where I should go. So if I am unwell and something happens, I'm not really happy about it, who do I speak to? Do I speak to the government because they fund the service? Do I go to the person who actually did the thing to me that I didn't like? Do I go to their manager, to their organisation? That can be a bit difficult for consumers, and we're advocating strongly for that to be better done. More broadly, for us as Consumers Health Net Forum, what we really encourage people to do is to come to us and come to our webinars. We're running a webinar in a few weeks on vaping. There's a lot of change going on in vaping, and we know a lot of people who vape haven't really had much of a say or don't really know what's going on. So we love everyone to come to that, and then we run a chat and a Q&A. People put all their ideas, their thoughts, their questions in there. Sometimes we can answer them right on the spot for them, or other times we can take those concerns, bundle them all up, and then send a letter or have a meeting with government saying, these are these issues that people are raising. So if you've got a personal issue, we encourage you to go to the relevant complaints area. And again, sometimes CHF or the state-based organisations are really good at helping you find who you should be talking to. They may not be able to help you make the complaint, but they can help you say, this is the email address or this is the organisation you need to talk to. If you've got a broader issue like, I had this experience and I realised that this service doesn't cater for people with my particular disability, or I realise the services that I need are not funded by the government or they're not free, then that's at that level of system advocacy where we tend to get more involved. That's where you come, write an email to our info at address, look out for opportunities to be part of a consultation about that issue. All of those things, raise your voice whenever you can, not only with us, but with anyone else, to help make a difference at the bigger level, because then, of course, it will be beneficial to you, but it might be beneficial to hundreds, thousands, or even millions of Australians.
So, what advice would you offer to LGBTIQ plus consumers trying to navigate the healthcare system and access needs?
And I mentioned this a little earlier, understanding what's available to you. So, what do you need and where can you get it? If you have some great relationships with peak bodies, I'm in Naarm today, so Thorn Harbour, for example, if you've got questions about issues related to HIV, that would be a great place to go. If you have other concerns about how to find services, then maybe your local GP or your nurse practitioner might be a good place to go. So wherever you're getting your care. So I like to say to people, okay, find out or start to think about what you might need and then find places that can help you. They may be virtual, they may be, you walk in the front door and talk to someone, all kinds of places. And then if you're not getting what you need, then you need to find a way to speak out. And that is finding out, okay, how do I help someone advocate with me or for me to get better access to services or find out about new services. That is tricky. Sometimes Health Direct can be helpful depending on what it is you need. They've got, a big website and phone numbers you can call. Sometimes they'll be a good place to go to. They might say, oh, well, actually, there's this thing in your area because they've got a directory of services. So that might be helpful. So knowing what you need, finding out the organisations that are supporting your needs, then going to them or individuals who work there and saying, this is what I need. Um, and being confident to do that and hopefully being able to find environments which are inclusive and supportive so that you can talk about your health needs, whatever they are, in a relaxed way, as relaxed as you can be if you're unwell, and not be concerned about there being any inappropriate behaviours or behaviours that you don't feel are inclusive and welcoming. And then, of course, hopefully you get better and then you'd like to stay well. So then we encourage you to also engage with any activities you can to keep yourself well and healthy. I mean, your own bed is the bed you prefer to be in. If you're fortunate enough to have a roof over your head and a safe place to sleep, that's where you want to be every night. So, how do you stay there? It's keeping yourself as well and healthy as you can. That means learning about any health conditions you might have, learning generally about what good, healthy lifestyles, kind of activities might work for you, and engaging with them. So, I went for a walk this morning around the lake to see the baby swans. That's really good for my well-being and my general health. For someone else, it might be crochet. For somebody else, it might be a cup of tea at a cafe. So find out what keeps you well, mentally, physically, spiritually, and try and engage with that as often as you can.
Dr. Elizabeth Deveny, it's been an absolute honour and privilege speaking with you. As always, you are so affirming and inviting, and as somebody who's trans and gender diverse myself, I have nothing but praise to say for the Consumer Health Forum. It is a space that really welcomes diversity, embraces a diversity of ideas, and I can't speak highly enough of this space. And for all our listeners out there, we will be putting a link to their website and ways that you can become involved. But I think I'll leave the last word for you, Dr. Elizabeth Deveny, to our audience.
So just a delight to be with you and have just a chance to have a bit of a chat about some important issues. So I'm on the record as saying prevention is better than Medicare. So while it's great for you to know how to find a service and use it, even better if you don't need to. So the best thing that could happen out of today's conversation is that people think about what's the one thing I could do to keep myself well? Is that putting a glass of water beside my bed and starting the day with a glass of water? Is it going to see my GP because I haven't had my immunisations or screenings that I'm due for? Is it booking an appointment with somebody else to start a health conversation? So I'd love to think that everyone would do just one thing to keep themselves well and healthy, and that'll make me smile. So, and thanks again for the opportunity.